Welcome to the Dental Implant Practices Podcast, where each episode will explore how to integrate dental implants into your practice and into bone, with your host, Dr. Philip Gordon.
Hey guys, thanks for being listeners of the show. Go to dentalimplantpractices.com and find all of our resources. Also find us on Facebook, Dental Implant Practices page on Facebook, and go to iTunes and leave me a review on iTunes so we can help spread the message. Thanks. Welcome back to another episode of the Dental Implant Practices Podcast. I'm your host, Philip Gordon, and it's a huge honor for me today to introduce Ady Palti. Ady is a dentist that is an oral surgeon, actually, with a focus on implantology and cosmetics. He is the ICOI executive board member. He's the past president of the ICOI. He is chairman of the Credentialing Committee and director of the ICOI Europe. Ady, thanks for being on the show here with me today.
It's a pleasure to be with you online and to share with you the ICOI activities worldwide and especially in the States.
Great. Now, if people haven't heard of you before, why don't you tell people a little bit about your education, where you did your dental training, where you did your implantology training, kind of how you got involved with the ICOI, and then what you spend your time doing these days?
Well, my implant training had been done at the beginning at a Mission Institute, and then I took a training program at Boston University. It was years before in the 80s. Unfortunately, the implant center at BU disappeared. And I took oral surgery in Europe, in Romania, and in Germany. And actually, I focus on advanced implant cases, aesthetic dentistry, 3D planning, immediate loading, and the 3D cone beam with surgical guides. That's more or less what we are doing on a daily basis. I inserted about 32,000 implants in my career. And I have 2 offices in Germany and teaching at NYU and Temple University nowadays.
Well, that's quite a career you've had. I know those all those accomplishments. You've really done a lot of neat things with your time in dentistry and really done some groundbreaking stuff. How did you get involved with the ICOI?
Well, about 28 years ago, the ICOI came to Europe, to Germany. It was a meeting in Berlin, and I was impressed by the international activities, which were actually at that time, nobody talked about implants. Implant dentists were treated like very special, very weird guys. So the ICOI was a kind of big family, which opened the doors and made it international access for all of us. And Dr. Judy just asked me if I want to work with ICOI. I said yes, and I'm still here since about 28 years. And ICOI gave me a lot of education by being a part of the educational programs. And of course, the person who influenced me the most was Carl Misch, which was my teacher, my mentor, and a great friend.
Yeah, I know everyone's sad with his passing this past year, and he did a lot for the implantology field and a lot of people's careers. So I know a lot of people miss him. Now, you do some teaching here in the United States. Where do you do that teaching at?
Well, I'm teaching most of the time at New York University, and I teach also at Temple University in Philadelphia. But my major teaching activities are at NYU, based on aesthetic dentistry, aesthetic implantology, different techniques of augmentation, 3D planning, and modern technologies and new techniques.
Yeah, that's fantastic. I know that's where a lot of the rapid changes are maybe happening in implants these days is with the guided technology and the immediate loading and the aesthetic concerns. That's where all the emphasis is on. And I know we'll get to all that. What type of implants and guide systems and CBCTs are you using in your private practice these days?
Well, I'm using actually at the moment I use the Park dental implants. We developed some new plate implants, which actually goes back to Lenny Linko's old blades. We try to do it minimally invasive I'm using the internal hex and the more tapered Starvent from Park Dental, located in New York. But in my career, I developed a few implant system which is actually on the market was the tapered Screwvent, which I designed many years ago. And most of the implants I'm using are tapered design with the internal connection with the internal hex or more tapered. And of course, some of the cases we use even the small diameter, the mini implants. So actually, we cover all the implant systems and field. I'm working with some navigation systems like Navident. We work with Sirona imaging systems for different navigation and surgical guides. So actually, the future in our field is, if possible, minimally invasive, and patient expectation goes toward aesthetics. So backward planning like digital mock-up and wax-up will be an important part of our profession in the future.
Yeah, absolutely. You know, the aesthetic demand of implants has definitely risen, and the guided technology has definitely allowed for a lot of doors to be opened with those sort of things. Any other trends that you care to talk about with some of the things that you teach?
Well, I think that if you look at the structure of our patients, they are old, so 75% of our patients are over 60. And these patients actually, based on my experience, more and more would like to have minimally invasive surgeries. I know that the tendency goes into augmentation and soft tissue graft and everything, and it looks fantastic. But these elderly patients would love to have everything at one-stop shop. So if we can do minimally invasive surgeries and still cover the prosthetic demand, aesthetic, and functionality, that will be an important part of implantology in the next few years.
I definitely agree with what you're saying. There's definitely a need for that in where things are headed, and it's good that there's some good training out there to do that, and I'm glad you're leading the way with that now. With your involvement with the ICOI, you are on the executive board. You're also chairman of the Credentialing Committee. So let's talk a little bit about some of those things. You know, the implant world has kind of been on this advanced movement for credentialing. I know you guys have a lot of things with that. Now, let's just start off with the membership. What sort of membership benefits would someone have with joining the ICOI?
Well, that's a great question. First of all, people are taking courses and spend a lot of time and money to get education. And I think that all these educational courses and activities should be recognized by the credential. Actually, if you finish a basic course, wherever you take it, your patient should know that you are an implantologist or you are in the field of implantology. So we start with our fellows, and you need to have 20 cases, which is the beginning. It's an easy start. And then we have also a lot of dentists around the globe which don't want to be involved in surgery. So we have the prosthetic mastership as a second level of credentials. So if somebody just focused on prosthetic, he can get a certificate after passing the exam and showing his cases. He can get a master in implant prosthetic from the ICOI. The highest level is, of course, the diplomate. And we are working now, due to the new changes in the United States, the ADA, and some other activities we work on, giving our members, after a written exam and an oral exam, the title diplomate of the ICOI board certified, which will put you at a level almost as a specialist. And I think this is a breakthrough in dentistry, because implantology was never recognized as a specialty, but patients need to see what is the dentist doing in order to improve his skills. So the diplomate board certified will be a great achievement for every dentist who wants to go into the implant field, getting his education, the recognition, and showing it to the patient. We have a few thousand of clicks per day on the ICOI website, and of course we list our fellows, masters, and diplomate. So patients get information directly through the ICOI website. So it will increase the number of patients. It will prove your expertise. And this is a part of ICOI activities, a small part.
Yeah, no, that's excellent. Now, if someone goes to your ICOI website and they go to the credentialing page, I know it lists the fellowship requirements. It says you have to complete 20 cases, but if you place and restore, that's just really 10 cases. Is that right?
Well, there are some changes. If you will go nowadays, you will see the new requirements. We adjusted it. It has to be 20 cases if you restore and do the surgery. And we are actually going with the flow, and the credential and the requirements are increasing. In order to get board certified, it's a tough written exam, it's a tough oral exam, and you have to have 4 years of experience and 200 implants at least to become a diplomate, which is actually compared to a specialty. And we have tough rules, and I think that will be really important for everybody to have this certificate to prove his expertise to the patient.
When it talks about candidates who place implants, it says they must be 1 year from surgery when you're providing documentation on these cases. I think that's good because it shows it has to be successful. And now when it shows the restoration, does the restoration have to be 1 year old as well?
Yes.
Okay. So.
Well, it's a good question. I see we live in the Facebook area, and the young generation, what I see many times, they do a case in the morning and they post it in the afternoon. I understand it's very exciting, but this is not long-term dentistry. They have to be very careful with all those published cases on Facebook. We try to come back and to go more into the scientific part and the long-term success, which is important for the patient. And I think that the fellow, master, and diplomate show to the patients that they deal with a serious, interested colleague doing implantology on a daily basis and researching and working hard to get his credential.
Now, when it talks about the hours of continuing education, can those hours of continuing education be, as long as they're implant specific, can those be taken anywhere?
Well, we recognize the CERP, continuing education recognition point, from different societies in the States, of course, but also international courses. So it has to be a recognized course. It has to be an official course. So, of course, we recognize it globally, wherever you took it, if you can prove that this course had the recognition point. What we don't recognize anymore is company courses. Because the company courses are good and are important, they're interesting, but more or less they try to sell you implants. They don't really want to teach all the time. So that is why the CERP is not recognized. Even at our meetings, we are very careful with giving the CERP points for the meetings we give, because the companies are doing a lot, but this is not a part of the education we accept. So nothing against it, but you need to take a course like Mish Institute, Michael Picos, whatever, all those serious educational programs in the United States or abroad.
Gotcha. So it may depend which course, and even if it's CERP certified, it may not be qualification if it's from a manufacturer. Is that correct?
It's a little bit, yes, it's a little bit difficult because you can take 10 courses from 10 different manufacturers and they will all show you how to insert an implant. It doesn't make you a specialist yet. So we have to go more into the advanced technologies and surgical demonstrations that's hands-on. So it's a kind of complete education we would like to see.
Yeah, absolutely. More of the continuum type than just the...
Yes, a curriculum, a continuum type, a structured ICOI, structured education.
Okay.
Basic education, it's about 8 weekends, 16 days, 144 hours. This is a kind of recognized education, learning anatomy and troubleshooting and hygiene. So it is a structured education which gives you really an overview with hands-on on the implant field.
Now, what sort of courses like that does the ICOI kind of have structured set up for people?
Well, we support and work very tightly with Mich Institute. There are some institutes in California. We work with Ficus Institute in Florida. So there are different courses we recognize, we support, and which are a part of our educational program in the States. Internationally, we have curricula in Europe in different languages for our international members, like in Germany, in France, in Poland, in Israel, in Greece. So we are spreading the knowledge. Japan, China, Australia, we spread the implant knowledge worldwide to our members.
Sure, and I think that's with various meetings and international platforms and the internet, that's definitely something that can be done these days.
Yes, we have a platform which is called ICOIstudyclub.com, and we are delivering free webinars for our members, at least 2 per month. So being an ICOI member, you get education for free. We are a non-profit organization, so we deliver education for free if it's possible. And of course, we have something interesting for our members starting this year. If you want to have some videos or animations for patient education or for your own education, we give our members every year 60 free animations from Dental Master, which are a part of your membership fees. So the value of this animation, if you look over the 3 years, it's more than $1,000. So it's worthwhile to be an ICOI member and getting these animations, which are free of charge and only for our members. So it's a great achievement for education, for patient education or treatment planning, a lot of interesting modern technologies. We just give it for our members for free.
Yeah, that's definitely a benefit for sure. Are those the Dear Doctor patient videos? You're talking about the Dental Masters animations for patient education?
Absolutely, Dear Doctor. I see that you are very well prepared. Dear Doctor is a great tool for patients. You can put it on your website. You can educate your patient. I think that's fantastic. And we have a glossary, an international glossary, which is accessible for everybody. We want to spread the implant nomenclature worldwide. So if you click on our website, you will see our glossary there for everybody accessible. It's in English, but it will be translated in multiple languages. So we spread internationally all the knowledge that you need for implantology.
That's fantastic. What else would people need to know about the ICOI that we haven't covered yet? I know we've talked about some different ways to maybe become credentialed and some of the member benefits, maybe some about the ways to get CE. I mean, what other topics do you think we need to discuss here that maybe I haven't asked you yet?
Well, it's a nice question. Actually, being a part of the ICOI family since almost 30 years, I can tell you that one of the major points of the ICOI is camaraderie. So, of course, when you go to meetings, you get knowledge, but you also need to have the family feeling. So you learn enormous during the breaks. You learn at the bar. You learn wherever you meet these people. So I think that a replacement for all the online education is having these meetings. And the ICOI has fantastic programs. So not only learning implantology, but you learn also the world. Like, I'll give you an example what's going to happen in the next few months or few years. We have a meeting in Krakow in June this year where we're going to discuss, we have a consensus conference discussing about standard of care for an edentulous mandible, which is, there are so many solutions to implants, ball attachment, 4 implants, all on 4, 6 implants. People are confused because they confuse science with marketing. So I think that a consensus conference on the edentulous mandible will be helpful for the profession. Then we have our 45th anniversary in Vancouver in August this year. Then we have a great meeting in Orlando next year. And last but not least, our biggest meeting will be 2018 in Las Vegas. And we have a cooperation with the FDI. It is the World Organization for Dentists about peri-implantitis. And we will present the results of the peri-implantitis research, which is a 2-year project, in Las Vegas next year in September. And then 2019, we will be in Phoenix, Arizona. And in between, we'll have meetings in Marrakesh in March 2018. And 2019, we start a new project, which is called Conflict and Dialogue. We would like to have 2 speakers on stage talking on controversial topics. One will be like, for example, for surgical guide, the other one against. And each one will have 1 hour, then 30 minutes discussions. So I think for the young dentists, young implantologists, it's very important to hear these discussions and to get really a consensus, a solution for their own practices, not just being a part of a meeting, you see 20 speakers on stage and then you go home and you still don't know exactly what they wanted to say. So I think that Conflict and Dialogue will be an interesting project. And last but not least, you are a young dentist, Philip, and we have, at every meeting, we have a young implantologist podium, which are 10 international young speakers. We give them a platform. And we are looking for the next generation. We try to support young people to be on the podium and to show their talent and to motivate them to research and to present. So the ICOI is looking forward to see these young people doing fantastic. I can tell you that some of the presentations are even better than the main podium. So this will be the way to go in the future.
Excellent. So it sounds like they've got a lot of things covered and a lot of thought put forward for the future and continuing the great tradition of the learning and teaching and mastery of the implantology. So that sounds like a lot of good things to look for.
Yes, actually, it's a kind of event when you come to a meeting, you see the young people growing, you meet the old people, you see the new technologies coming, and I think that Conflict and Dialogue will be something new, having these 2 speakers on different topics with different opinions, and it's an interactive because people can ask questions during the sessions, and there will be microphones, or you can write an email during the session, and it will be moderated from the stage. So I think that we are going into new concept. We will like to have in Marrakesh next year, we'll have live surgeries transmitted to the audience. We try to make our events more interesting for the participants. I think that will be an interesting try to see how the young doctors react on our project.
Yeah. Well, anytime you're setting up proactive debates, that's a good way to test your knowledge. When you have people challenge what your background is, based upon new thoughts and new ideas, that pushes growth for people. So I think that's an opportunity for everyone to learn.
Yes, especially the young people are very interested in new technologies, and they want to see the controversies because there are a lot of discussions on different topics nowadays. Do we need 10 surgeries to create a papilla if the patient has a low lip line, for example, or it's enough to make a pink ceramic? It's just one discussion. Another discussion, do we need a lot of augmentation, or can we use some small diameter implants or platform implants instead of 2-3 surgeries like hip augmentation, major surgeries? So I think that we should have this discussion on the podium and let the audience be a part of it. That will be something new, and I'm sure that people will react positively. Because when I go to meetings, I have so many questions, and I'm not getting answers. So this will be really an interesting new project. At the end of every day, all speakers will be an hour on stage and will answer questions which occur during the lectures. So I'm very excited about these new projects, and I would love to hear the opinion of mostly of the young people. We have also our Facebook page pages where people can ask questions. We try to be, as a nonprofit organization, to be there for the dentist, and most of the things we deliver are for free. If you are an ICOI member, you get these animations, you have the credentials, you get the meetings, you get the journal Implant Dentistry, which is a highly respected publication. I think this is what people would like to see, and of course the free webinars. And I would love to hear if you can collect information from the young generation to see how people react on all those activities. Will be a great interaction.
Yeah, I think there's a lot of changing topics and controversies in implant dentistry and dentistry in general. So I'm glad there's some leadership that is taking charge with that and kind of leading the way, so that dentists and the public alike can know that the people with the right answers are the ones making the decision and leading the future, and it's it needs to be an evolution of science that kind of backs this up, and processes that can build upon each other.
You said it, Philip. If you look into the modern life, young dentists, Facebook, Instagram, what I'm scared that, like having an idea and make it available for everybody. Some of the people are very talented, some of them are less talented, and I'm scared for the patient. Like one of the examples is the PET, partial extraction therapy, like cutting half of the root, putting the implants in. This is already 10 years on the market. But now it's a new buzz. But there are no exact indication how much you cut from the root. Does the root have to be ankylosing or not? It has to be a vital root or a root canal. There are so many questions which we have no answer. So just posting some interesting cases doesn't mean it's evidence-based. So it can go in the right direction, but it can become like a boomerang. So I think that we have responsibility to teach people evidence-based what works. We have a lot of experience nowadays, and I think that we should teach what we know it's working and let the leaders try all those new technologies. Not everybody can do it. So I think we will have a lot of new impact on the implant field in the next few years, and I'm excited about it.
Yeah, absolutely. So if somebody's looking to get started with the ICOI and saying, what, I've done some cases and I feel good about it, and maybe I want to go through the join the membership and go get my fellow. What's the best way for someone to get started? I mean, obviously get on the website and check out the fellowship application, but what's the best way to do that? Is there anything that they need to know or think about, or is it all pretty well spelled out for them? That's
a nice question. If you want to go actually to the site and look for the fellows application, it means you are an implantologist already. But if you want to start with implantology, you should join the ICOI, and we can deliver basic education first. So most of the courses we have, when you finish the course, you already did your 20 cases. Most of them are like this. So after you finish the basic course, you can apply for fellowship. Becoming an ICOI member means you are part of a big family, and you will have mentors. Each of us is trying to help the young generation. So being an ICOI member means you have some guidelines, you have some people, you have some mentors to guide you to the next level. Of course, fellow is the first level, but then you have to collect your experience under supervision of experienced implantologists or our speakers, board members, executive. We try to guide the young people. And you will see how the young generation react. When you come to our meetings, you see this young implantologist podium, which are your peers, our colleagues, which started 1, 2, 3, 4 years ago. So exchanging the experience with these guys, it's very important nowadays. Because, as you know, you can get everything online, yes, but online is not a replacement for face-to-face education. And becoming an ICOI member, being a part of the big big group. People will guide you exactly how to pass the first fellow level, and then if you want to be a prosthetic specialist, the master, and then to the diplomate. So being an ICOI member is a long-term relation. That's the way I see it. It's not you come there, you get your fellow, and then you disappear. We would love to just guide you to your next level. That's a part of the philosophy we have nowadays.
Yeah. So you're, obviously, people are looking for, a sense of belonging and some guidance and some mentoring and some camaraderie. And
that's exactly what you mentioned. Yeah.
Yeah. Seems like, you guys have it set up for all of that so that whatever stage people are at, there's a place for them to enter in and have some assistance and have some, some colleagues that are there to assist them in any sort of way.
You can go and visit one of our experts near your place. We have a lot of people spread in the world, not only in the States. So if you need some comments, if you need some guidelines, it's always somebody there. You can send an email to the central office and to ask, well, I need somebody in my area. So we always find somebody in your area. And of course, we support the young generation extremely. We have training programs. We are thinking on having some pre-Congress program like Train the Trainer to guide you how to take pictures, to guide you what do you need in order to be a speaker, or what do you need to make nice picture for the fellow, for the fellowship or for the mastership. So I think that implantology is not just getting a course and start doing it. I think that the fact that you can exchange experience with your peers at the meetings gives you much more benefit than just the course or the meeting itself. And personally, I think that will be the way to go for every young implantologist who wants to find a big family, a big group on an international level. Like the ICOI is like things global and act local. We are global. We have 15,000 members in 103 countries. So with the ICOI, you get all the information. Implantology is global. So there are great ideas in Korea, in Germany, in France, in the States. And the fact that you exchange experience with all those colleagues makes you a better implantologist automatically.
Yeah, absolutely. So is there any topics that we need to discuss further? I know maybe the best place for people to start is they go to the ICOI.com or .org.
ICOI.org.
ICOI.org.
For the United States.
Yeah.
Yes. We have actually three big groups. We have ICOI.org for the United States, Australia, Canada, the English-speaking areas. We have ICOI.eu.org, which is in 16 languages, in Spanish, and German, and French, and Italian, Polish, whatever. And we have ICOIAP.org, which represent the ICOI in the AP section, like Chinese and Japanese and Korean and all those other parts, because actually every country, every area has different specific needs. So we act locally, we help, we give lectures in South Africa, we give lectures in Tokyo, we give lectures in China. So it is easy to go to the website to find our courses, our meetings, our philosophy, and last but not least, try to attend one of the meetings. But the best will be to be in Vancouver at our 45th anniversary. It's a long time, 45 years being around on a global scale. It's tough. So Dr. Judy, when he created the ICOI, he had a vision, and I think we really fulfill his vision, and we try to do our best to get everything done. And especially in the United States, you have a lot of meetings locally, but it's also interesting to see what's happened, abroad. So it makes it a kind of education, but also a social event. And like you mentioned, camaraderie and collegiality, this is what counts. So you will have mentors, you will have people who will guide you. And when you start implantology, you are so happy to have somebody to talk about your cases and to show you what you did wrong or what you can do better. I think that's the way to go, to exchange experience and to find the right way for your patient, for your office. Every office is different. So we can help you find the right implant concept for your area.
Yeah. There's lots of, everybody can learn and everybody has room to grow. So it's always good to, no matter what level you're at, to, look at what you can do to improve. And there's always someone who's further on from you that you can, gain experience from. So I think it's, definitely important for people to go to these events, have fun, learn what new technologies out there, and then have people to help them grow and push their standards so that, you're always kind of working towards that ultimate level of mastery.
Well, I think that the best way to learn and to avoid mistakes is to learn from the mistake from others. If I go to courses or if I teach, the most economic for me will be to learn what are the people around me doing wrong, so I avoid to do it in my office, because that can kill your office. So going to meetings and learning from other people what not to do, it's already a huge benefit for your office and for your practice. So I think that we should be more open and talk about our failures, our complications. They are not enough on the podium, but I think that we can implement it to show when you go home what not to do. Because when you go to a meeting, you get 3 points when you go home. 1, you get confirmation that you are the best, you do everything right. The second is you learn something new for your daily practice. And the third one, you learn what not to do. So this is the mixture you take home after every meeting, usually. So I think that going to meetings and exchanging experience with experienced people will make you a better dentist and will make your practice going better and smoother without complication. That's the main idea of the ICOI.
Yeah, I think, some of the best lessons you learn in life are from your failures, not necessarily from your, successes. So taking the failures from others and learning from those can definitely elevate you just as much. So people that are willing and open and honest to, share with you the things that they've stumbled on. And if you can learn from all of those from other people, I think you're going to be, definitely further ahead than if you think, you know everything and you're not susceptible to any of those failures. You're going to have some hard lessons taught your way at some point.
Well, the first step when you want to learn something, the first step is when you recognize that you don't know everything. If you think you know everything, then it's useless to go to a meeting because you know everything already. But I think that nobody knows everything, so we all can learn from each other. And I enjoy looking at the young implantologist podiums because there are some interesting new ideas, new aspects, and every generation grow up differently. So we really can learn from each other and we can improve our skills. Every time you talk to somebody who is doing implants, and I'm not talking only about implants, I'm talking about office management, improving the financial situation, new instruments, new techniques, new features. So new implant system, for example. So it is so important to exchange experience with colleagues on a regular basis. I think that will be the major connection, especially when you have all those digital world, digital media, webinars. This is a part of it, yes. But being in your office alone, it's a kind of problem. So going to these meetings will really open your mind. Beside the Facebook and the Instagram and all those YouTube, actually, theoretically, you can learn implantology on YouTube. But I don't know if it makes you a better implantologist if you look at 10 videos and you go next day to do it on your patient. You need somebody to guide you. It's like driving a car. You learn by doing, but sometimes you learn it the hard way. That's a kind of experience. You don't want to do it yourself. I hate to make mistakes. So if I learn from other people's mistakes, it will make me a better dentist.
Absolutely. So, Ady, I think we've had a good session here. I'm trying to think if there's anything we missed, and I'm not sure that we left much on the table. I know For people in the U.S., they can go to ICOI.org and pick up and learn some things there, figure out where the next meetings are, look for that membership to join and look at those credentials and start figuring out a path to do that. I know getting to some more of those meetings and getting the ICOI fellowships definitely on my agenda this year. So you'll be hearing from me a little bit more, and I would encourage anybody out there to who's serious about dental implants to get with the ICOI and become a member, go to some of the meetings and start tracking down those credentials. Because I think if you do those things, you're going to have probably more benefits and good things happen to you than you would ever think of. So just by being part of a membership and an academy and credentialing process, that puts you around and forces you to think outside your box and become better. And I can't think of a better place to do that than the ICOI.
Wonderful. I think that you will have also on our website like a matrix, like a PowerPoint presentation. You put your cases in, so it will make it easier for you. And of course, don't hesitate to call the central office. There are always people which would like to help you, and we are available for everybody. You can send some pictures if you need some information how to do it better. We are there to help you. So when you come to the ICOI, you will feel very well taken care of. And of course, the fellowship will be your first step, and we will guide you to become a board-certified diplomate. That's what everybody wants to get. And even after you are a diplomate, we will try to give you all the new features, all the new technologies to make you a better dentist and to make you really a good implantologist.
Well, you know what? I appreciate your time. I know it's you're in Germany right now, and it's pretty late where you're at. So I appreciate you staying up and talking with me and making time for this interview. And I hope to see you at a meeting coming up soon, and we can continue this conversation in person and help spread the message of the ICOI and the message of implant dentistry. Okay.
Thank you, Philip, for your kind interview, for the possibility you gave me to talk about ICOI. And I'm absolutely convinced I will see you at one of our meetings, and I look forward to it. Thank you very much, and hope to see everybody in Vancouver or to another meeting. Bye-bye.
Bye-bye. Thank you.